Diabetes and diet. Healthy eating is a central part of managing diabetes. In some cases, changing your diet may be enough to control the disease.
Always do it on my own, so I gotta get through it. And the only thing I know is to love what I'm doing. Never give up, never slow, till I finally prove it. Never listen to the no's.
Welcome back to Self-Care, Health and Wellness. Last video was about diabetes mellitus in general, and I told you guys that I will come back at a later date to present 4 different types of diabetes. Diabetes type 1, type 2 diabetes, pre-diabetes, and gestational diabetes. No, today it will be about type 1 diabetes. Yes. Guys, here's a diagram stating what is autoimmune disease. And here is where the autoimmune disease destroy your brain. And there are 2 examples of autoimmune disease here: multiple sclerosis and autism. Below you have the blood. Now we have 2 diseases here: leukemia and lupus, right? Below again we have the GI tract, right there, GI tract. And GI tract, sorry, is from your mouth down to your throat, into your stomach, right back to your anus. That is the GI tract. And the disease your GI tract got, one of them is celiac disease, right? Down here now you have the nerves, peripheral neuropathy, which is diabetes nerves damage, right? So you see the nerves over here, and across from it you have lung fibromyalgia, right? The lung fibromyalgia is when your lungs damage or scar, right? Across from there now you find the skin. So this is the skin, and some of the disease you get from the skin is cirrhosis, vitiligo, and eczema. That's some of the disease. Over here now you have muscle dystrophy, and this is one of the disease. And muscle dystrophy is when your muscle becomes weak over time. Above here you have rheumatoid arthritis, and this is the finger, so you have pain in the joint, right? And above it you'll find the thyroid gland. See it in your throat, 2 sides of your throat, the thyroid gland. And the thyroid gland is when you have infection in the thyroid gland, you get grave disease, right? So when the thyroid gland is inflamed, right, grave disease, that's one of the disease you get. Okay. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is made. It is unclear what causes this attack. You are more likely to get type 1 diabetes if you are a child or teenager, have parent or sibling with the condition, or carry certain genes that are linked to the disease. Symptoms of type 1 diabetes can include bedwetting in children who previously didn't wet bed during night, extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, changes in mood, and tiredness. Causes of type 1 diabetes. Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Environmental factors. Age. Treatment for type 1 diabetes. Insulin is the main treatment for type 1 diabetes. It replaces the hormone your body isn't able to produce. Diabetes and diet. Healthy eating is a central part of managing diabetes. In some cases, changing your diet may be enough to control the disease. Your blood sugar levels rises or falls based on the types of foods you eat. Sugary and starchy food makes blood sugar level rises rapidly. Protein and fat cause more gradual increase. Your medical team may recommend that you limit the amount of carbohydrate you eat each day. You will also need to balance your carb intakes with your insulin dose. Work with a dietitian who can help you design a diabetes meal plan. Getting the right balance of protein, fat, carbs can help you control your blood sugar.